Hello, once again. Welcome to the Pundit Place, where we discuss curated content that are thoughtfully designed to keep you informed about health, management, lifestyle in general. My name is Jude. So, today we'll be discussing a very important topic as well, the initial steps of newborn care. In our last topic, we talked about the initial evaluation of a newborn, and now we're going to be talking about that initial assessment you need to take or initial management of the newborn from the time the placenta has been cut up to the time they transition into the world. Okay, so the first we need to do is to ascertain whether this child will need resuscitation or not. If the child doesn't require resuscitation, then the first we need to do is to provide warmth. It's always important to provide warmth for the baby because that moment you cut the placenta, you have cut the baby off the temperature of the mother that has probably been sustaining this baby. You've cut the baby short of oxygen. You've cut the baby off food supply. So you should now manually or temporarily sustain this baby until the mother will be able to breastfeed the baby. Now, the first is to ensure that this baby is kept warm. Keeping the baby warm helps to provide oxygen and normalize the temperature of the body, supply glucose and oxygen to the brain and other vital organs of the body. The second you need to do now is to position the head and the neck. When you position the head and the neck, you are aiding adequate breathing and ventilation. Oxygen will be able to go through the airways down to the lungs to supply the lungs and make it active. You know, prior to delivery, the lung is known as the vestigial organ, an organ that is inactive prior to delivery. But the moment the baby takes in the first cry, okay, that first cry gushes air into the lungs, thereby activating the lungs, closing up all those holes that connects the baby's heart to the lungs. Okay, so there's something we call the fetal circulation. There you have the foramen ovale, the ductus arteriosus, and the ductus venosum. These are some of the terminologies we use when we describe those openings at strategic locations between the that connects the baby's heart to the lungs while the baby is still a fetus. Okay, meaning that the baby was still in the mother's womb. So at that time, the lungs of this baby were not active. But with the gush of the first cry, the baby's lungs become active. Okay, so it's so important for us to ensure that the head and neck in well alignment and ensure that secretions are drained off the mouth. We need to suction appropriately and also make sure that the baby does not aspirate saliva or mucus. The fourth is to keep the baby dry. Like I said, the third is to suction and ensure that no secretions are there. Then the fourth is to keep the baby dry. And then the fifth thing is to stimulate. We need to stimulate the baby. So we need to stimulate the baby by gently drying, even the drying of the skin, keeping the baby dry, touching the baby, stroking the feet. These are things or activities that stimulates the baby. All right, so these will help to ensure that the baby has a successful transition into the outside life. If the baby does not transit properly to the outside life, there is a possibility that is going to be left a hole in the heart. Okay, what we literally call a hole in the heart. That is, either of those openings, either the foramen ovale will be kept open or the ductus arteriosus will not close up due to inability of the baby to take in the first cry, and then causing what we call a persistent ductus arteriosus, what we literally call the hole in the heart. And such children, by research, do not always last long, especially if they do not seek expert consultation and management. Sometimes it might require surgery from age 5, then it is mature enough to be operated on. If not, some of them might still live longer up until their teenage age or even the early adulthood, and then they pass on. But in order to prevent this from happening, it starts from the time of conception, from the time the woman knows that she is pregnant. She has to modify her activities, not taking alcoholic beverages, understanding her routine medications to be taken appropriately, also ensuring that she does not indulge in drugs and drug abuse or substance abuse. And then there are some factors that are just put together. Some of them are also iatrogenic, meaning that they do not have a clear cause or predisposing factor. So some of them might have been due to some genetic mutation or changes in the gene during the fetal growth. So please and please, in order to ensure that this baby that has gotten to term has a successful transition from the water life, that's the mother's womb, up until the time of up until the stage of the physical, what we all call the terrestrial life. Okay, we need to ensure that we do the following: 1, provide warmth adequately. 2, position the head and neck well. Then 3, you need to ensure that the airway is clear of any secretion. Suction the baby appropriately. And then 4, you need to keep the baby dry. Keep the baby dry. Keeping the baby dry ensures that you're also preventing infection. Okay? And then the 5th thing you need to do is to stimulate the baby. Stimulate the baby, touch the baby, keep the baby wrapped and warm, and then we are on to getting the baby to a successful transition. Thank you so much. Please don't forget to subscribe so you can always get updates when I have my posts, and you'll be well informed about how to keep ourselves healthy. And don't forget, always stay healthy. Bye for now.